personally work on an interdisciplinary team um, in a behavioral health psychiatric unit. And so I get the opportunity to work with um, occupational therapists, occupational therapy assistants, art therapists, and social workers every day. Um, and it's an opportunity for us to come together and to tackle the needs of our patients from a lot of different perspectives, a lot of different angles. Um, and what's really great is we really honor and respect each other's different disciplines and understand that we each have a unique approach. Um, and so it's an opportunity to kind of say, I don't have all the answers, but as a team, we can come together and give a really holistic and well-rounded um, approach or care to the people that we work with.
At the hospital, we work really closely with the social work team, with the child life team, with art therapy, and with psychology. But I probably work most closely with our rehab team, so that's occupational, physical therapy, and speech therapy. During a session with the rehab team, I use music to distract patients from all the hard work they're doing, and I can also use music to help motivate them to do all their exercises, which helps them participate longer. But sometimes just the act of playing an instrument, like a keyboard or the drums, because of the way they engage your muscles when you're playing, like these little fine motor skills to do the keyboard and these big muscles to play drums, is the therapy itself. Mm-hmm. And a lot of times it's really rewarding for people because the act of creating a beat and a melody with a harmony is really fun.
Yeah, great. Awesome. When you're working with, like, what does it look like when you're working with, like, the different members of the rehab team? Like, if you were to meet with, like, a speech therapist.
Sure.
Or do you do any planning with them?
A lot of times. So sometimes we do, like, a tiny huddle before we go to see a patient, and I'll ask what types of goals they're working on. And then we'll work together to work towards that goal. So I collaborate a lot with the infant rehab team, so the team who works with kids 0 to 12 months old. And so just the other day, a therapist was telling me they were wanting to work on some positioning and range of motion, and my job was to keep the baby really distracted and, you know, reaching for things and grasping for things so the therapist could sneak in some stretching and some other things like this. So I get, like, right down on the floor, I make the instruments really available to them, and I play age-appropriate familiar songs. So we do a lot of the ABC song, a lot of Twinkle Twinkle, a lot of Wheels on the Bus, and I have little maracas with handles on them so that it makes it easier for infants to hold. So just kind of prompt them to reach and grasp or visually track left to right.
Wow, okay, so sometimes you just, like, show up and you huddle really quick and then you just go in.
Exactly.
So it's just like boom, boom, boom.
Yes,
like,
exactly.
Sometimes you don't even get
most
to plan.
of the time. Yeah, most of the time it's kind of just like on a whim. Okay, here we go. Yeah.
Great.
Exactly. But I mean, because music therapists, our scope of practice is really pretty broad, and so most of the time it's, you know, something well within my wheelhouse.
Yeah. So I work in several schools, and so in that role there's a lot of collaboration with school counselors, with vice principals and administrators and teachers, so that if I'm working with a child, we can kind of determine together what's going on. If I'm seeing growth in a certain area in music therapy, I might ask, okay, is that something that's generalizing outward into home or into the classroom, or is that something where we need to kind of build outward from there? A lot of times I also work with kids who are in some way involved with foster care or CPS. And so in those situations, I'm working not only with professionals, also with parents, foster parents, and things like that, like family members in the various family systems that they might have. And then on top of that, there's social workers and other professionals, maybe other therapists, who get involved so that we can all work kind of holistically for the well-being of that child. Because a lot of times when a child enters care, everyone has a lot of little pieces of the story, and if we can't communicate with each other, then we don't really know what's causing a kid to act out in certain ways or to have a hard time attaching. And so we want to get as global of a picture as we can.
We work as part of a team to identify the patients that can benefit the most from music therapy. And then I sometimes often collaborate with other other practitioners, sometimes therapists, occupational physical therapists, speech language pathologists, and we will collaborate on the goals of care for those kiddos.
Nice. And who are the members of the team? Like, where does it start? Like,
Oh my gosh,
who do you...
I don't want to leave anyone out, but
Yeah.
it's a really big team. There's nurses, doctors, social workers, the therapists, occupational, physical, and speech language pathologists, child life specialists, pastoral care, chaplains, many people involved to work together to try and basically leverage all of their skills and all of their areas of expertise to help make the best outcomes possible.
At an adult life center that I work at with adults with developmental disabilities, I work with other instructors that know the students in different environments, different class settings, and we always work together just to find out how that student is doing and what they respond well to in different environments, or if art is a great motivator for one student, how can I utilize that in a music setting? If they're struggling with cooking or measuring, how can I take that into my own perspective and help with that in a music setting so that they can be successful in a kitchen setting? We also have a behavior analyst on staff who is great to converse with in terms of students and maybe behaviors that they struggle with and some deficit areas where we can discuss maybe functions of that behavior, whether they're attention seeking or trying to escape a task that is maybe just seemingly difficult for them, and how can we adjust our environment to better suit their needs.
Multiple meetings and multiple different ways that information is communicated.
Okay.
But yeah, we get report, and we get specific referrals because music therapy is a referral-based service.
Right.
And then we share that information, whether it's putting our notes in the medical record or passing along key information to specific providers.
Okay, cool. Yeah, so if it's like not everybody can be there in one place, but you guys make sure to be like, hey, this person could really benefit from music therapy, or these kids specifically.
That's right.
Cool.
That's right. Yeah, we try to communicate with lots of different folks on the team so that we can get those referrals to the ones that really could most benefit from our service.
Collaborating with other professionals allows us to use the strengths and the expertise of each professional to benefit the client.
So I'm part of the psychosocial oncology team at Swedish Cancer Institute. So that is a group of social workers primarily, our psychiatrist, an art therapist, and then a music therapist. And we work together collaborating on patient cases, referring new patients to each other. And we really are the team at Swedish, the outpatient team, I should say, that provides that psychosocial, emotional, mental health, mindfulness, wellness support for not only patients, but their family members or even any caregiver that's involved with them.